Today, we're going to talk about healthcare reform in Tuesday. Healthcare reform is a general rubric used to for discussion major healthcare policy, creation or changes. It's a government policy affect healthcare delivery in a given place. I chose the state of New York and also the state of Florida in which I reside. There was a plan for the state of New York to redesign the healthcare system. This healthcare system is to reduce costs, and reducing the cost can be a really great challenge for the state of New York. The vision is a three-part aim for delivery reform. One is improving the quality of care by focusing on safety, effectiveness, patient centeredness, timeliness, efficiency, and equity. Improving, second, improving health by addressing root causes of poor health, example, poor nutrition, uh, physical inactivities, and substance use disorder. The third one is reducing per capita costs. In order for New York to ultimately control healthcare costs, it must ensure that better care is provided, including proven effective prevention initiative resulting in improvements in overall health status and reduction in healthcare disparities. In particular, the biggest problem in the state of New York healthcare system is that is not successful in enduring that complex. High cost populations obtain the coordinated care they require. Changes in Florida health reform. There was a bill passed that introduces big changes in Florida healthcare facilities. Changes are included in clinical labs, nursing homes, home health provider, healthcare clinics, exemptions, and more. The similarities versus differences. Similarities are healthcare reform will bring skyrocketing healthcare costs under control, will result in saving for families, businesses, and states, also lessening the federal government spending. Healthcare reform is designed to make Medicare more efficient, ensuring that more tax dollar funded Medicare for seniors. Healthcare reform will also provide basic consumer protection that will hold insurance companies accountable for their actions like discriminating against the American people. The differences are that New York has their health reform as the HCRA. Florida healthcare reform was facing challenges in 2018, while Florida helped broaden the population that received reform coverage through either public sector insurance program or private sector insurance companies. New York reform provide quality care insurance to New Yorkers. Also, according to the Commonwealth Fund.org, they took they look at adult ages between 19 to 64. For Florida, 659 people were included. For New York, 710 were included in the statistic report, Rasmussen 2015. Recommendation: I do not recommend Rasmussen healthcare system to expand in the state of New York because of high taxes. The mess of the state healthcare reform is a long way out in repairing. In order for healthcare reform to actually do what it's intended for, New York officials must put New Yorkers first and stop filling their pockets. The healthcare reform has great intentions to provide quality and affordable care to all Americans, but it failed tremendously. In conclusion, healthcare reform needs a lot of improvement, and even then, it could be done fast or slow. Otherwise, Healthcare reform is very important, and we need to make sure that it helps benefit us and the people who really need it, rather than it hurt us. This is why it is imperative to fix the flaws, improve the reform, and make it better for people in both states and across the United States of America. Thank you.